When you're treating tennis elbow, the most important thing to understand is that there's no such thing as a one-size-fits-all treatment. And this is not just me saying it, the researchers actually agree with this. In this video, I am going to run through all the treatments you could use for tennis elbow and discuss which ones are backed by research, which ones have been shown to be useless. But then I'm also going to point out which ones you want to use depending on the stage of injury your tennis elbow is in, and also how you can decide whether the treatment is actually helping or maybe hampering your recovery. I will be sharing some specific tips for people who work in offices because it can be super hard to rest your elbow when you've got to do office work like typing or using the mouse. And then also for people who go to the gym. And if the tennis elbow is maybe interfering or feeling as if it's actually getting worse while you're going to the gym, I'll give you some tips on how you can decide what you can do and what you should stop doing for now. For those of you who don't know me, my name is Marika. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of any type of sports injury, all done via video call. Have a look at the description of this video if you want a link to our website. Tennis elbow develops in the tendons that attaches your wrist extensor muscles, so the ones that bring your wrist up and back to your outer elbow. Now, I've made a detailed video where I explained the injury process and all about that, but I'm just going to quickly recap the most important parts that you need to understand for your treatment. So why am I on about the stages of injury? Well, because depending on the stage of injury you're in, different types of treatment may be more effective for you. Tennis elbow injury actually comes in 3 stages. The first is the reactive tendinopathy stage. This is when your tendons just flared up, it's been painful for a few days, maybe a couple of weeks, and it's usually quite uncomfortable and can easily flare up in that period of time. Then the second stage is the disrepair phase. This is if the injury has carried on for a couple of months or so, then instead of that area of the tendon repairing, it now goes into a disrepair phase and it actually starts to lose a little bit of its strength. And then the third stage is the degenerative phase, where that part of the tendon is now actually going into a degeneration process where it really loses its strength and it loses its strong structure. It's important to understand that it's only a portion of the tendon that's affected in all of these 3 stages. It's never the whole tendon. So even though that part of the tendon may lose strength, the rest of the tendon can still be quite strong. But yes, like I mentioned, I made a very detailed video where I explain these stages in more details. So have a look at the description of this video if you want a link to that one. It's worth quickly talking about how you can use pain to guide your treatment. The research is quite clear about this, that tennis elbow treatment works best if it doesn't increase the patient's pain dramatically. So you can totally expect to have discomfort while you're doing things and day to day while you're recovering, but whenever you try a treatment or have a treatment applied to you, it's okay to feel a bit of extra discomfort, so you're a little bit more aware of it during the treatment or perhaps in the 24 hours after, because with tendons it's often later that day or the next day that you go, oh, okay, that's made it worse. So it's okay if you feel a little bit more discomfort than normal after the treatment, but ideally that discomfort should settle back down to your normal pain levels you usually have within about 24 hours. If the treatment is really, really uncomfortable while somebody is doing it, so you're a lot more aware of it and it's a lot more uncomfortable and you're like, that really hurts now, afterwards in the 24 hours after, then that treatment was maybe a little bit too intense. Now, it doesn't mean the treatment is wrong, it just means that you perhaps need to adjust it. So if it was massage, it needs to be done a little bit lighter. If it was exercise, maybe you just did too much. Maybe it had to be even fewer reps or lighter weights or different type of exercise. So it doesn't mean just throw the treatment out the door now that it's increased your pain. It just means it needs careful adjustment. Keep that in mind when you think about whether an exercise or a treatment is useful or not. I will also say people like to grade pain usually on a 1 to 10 scale. I struggle with that because what is a 3 out of 10 pain? So I don't tend to like to tell people that it's okay to feel a 3 out of 10 pain, because if you're an athlete or somebody who does a job where actually you're challenged physically every day, then you're prone to ignoring pain or discomfort. So your 3 out of 10 will be totally different from somebody else who doesn't do those things. So it's a better gauge for me to think about what's my pain levels normally, how much above that. So is it kind of the same? Is it just a little bit more irritated than normal? That I would say is an okay pain. If it's a lot more uncomfortable, or you're noticing it with things that you didn't notice it the day before, that's when you know that perhaps that treatment or thing you tried was a bit too much. If you're finding this information useful, please hit like. It will help other people also find this video. And subscribe to the channel if you want more research-backed injury prevention as well as treatment advice. The other thing that's important to understand is that the research clearly shows that there's no universal treatment that works for everybody in a specific stage of injury. It works best if the treatment plan is actually tailored to your injury and how sensitive it is. So if you want to know if a treatment is working or making a difference for you and worth carrying on, have a look at how your tendon feels 6 weeks after starting the treatment. Now, tennis elbow takes notoriously long to heal, and it's a slow process, and your recovery won't be just linear. But what you want to see is that you're better off 6 weeks since you've started the treatment. So if there's no real improvement, it's just carrying on in the same way as it did before you started it, then it's time to switch up and try something different. But if you're seeing slow, steady improvement and your flare-ups are becoming less and less and less, then it is a treatment that might be useful to carry on with. So when you think about, are you recovering or not? You're not looking for, ooh, every day I'm feeling better. What will happen actually is you're going to feel better, better, better. Oh, have a flare-up, but then better, better, better. And every time after a flare-up, we ideally want you to not go back to square one, because usually you recover more quickly. So as long as those steps back up from when you experience flare-ups is easier every time, then we know that you're recovering as well. But that's why it can be so useful to work with a physio to understand and help you analyze whether you're actually getting better, worse, or just staying the same, should you be switching things up or not. The question I'm often asked, especially on YouTube, is, can tennis elbow heal by itself if I just don't do anything? Yes, there are plenty of studies that show that actually tennis elbow can recover without any active treatment. And active treatment, we're talking about massage, exercises, injections, all of those things. There is evidence that it can recover without that. It still takes about 12 months. That's when people look at how people are doing, usually when the researchers look at how people have progressed. So it's not a quick fix, but it can recover. The tricky bit is, though, that it doesn't mean that you can just carry on as normal and it will recover. If you keep on irritating it, it will go the other way and actually get worse. So you do have to temporarily adjust how you do things to allow it to actually recover. And I'll go into that in detail in a minute under load management as treatment. Load management is by far the most important component for any injury for treatment. And basically it has two parts to it. The first is relative rest, where it means you've got to reduce your activities to a level that your injured body part can currently cope with, because it will have a sensitivity that flares up if you do too much. It may have lost a little bit of strength, which means it can't cope with so much at the moment. So figuring out how to allow it to rest is a really important step to allow that early recovery. But then there's a second step that people often forget about, and that is the careful reloading bit, because load management is not just about taking load away, it's about slowly and sensibly adding it back in so you condition your tissue to be able to take loads again. So with this, it would mean that for some people, depending on where you are in your injury journey, it may just mean that you rested for a while and then you slowly introduce your normal tasks. But for others, it may mean that actually they need to do rehab exercises. And we'll get to that in a minute. The three most common mistakes people make with load management is, one, they simply don't rest their arm enough. And then the tennis elbow can't get time to calm down and actually recover, and their pain just either stays there all the time at the same level, or it actually gets worse. The second is that they rested too much, and long after they should have started using it, they're still overprotecting it. Now, the weird thing with the body is, one, yes, you're going to lose strength if you don't use your arm, so now things that didn't flare it up before is now irritating it. But the second is, the more protective you become over something and you tell yourself that I can't use it, it's going to get worse, actually the brain then becomes more alert to that area and wants to protect it more. So then it starts creating pain for things that shouldn't be painful. So overprotection can actually cause more pain, not through worsening your injury, but actually heightening your alarm system. And then the third one is if people increase their activity too quickly. So a typical thing, especially in the YouTube comments I get, is people who say that I've rested it felt fine, went back to the gym, and now I'm back to square one. And quite often it's a case of, yes, you rested it for a week, it calmed down, but it wasn't quite ready to go back to your normal level of exercise. And even often people think that, oh yeah, but I only did like much less weight on it. But perhaps it's the volume of exercise that you did. So it's really important to slowly ease into rehab or normal activities after your pain has calmed down, or once it's started to calm down, because otherwise you can easily flare up. So don't just think you're back to everything. Give yourself a good few weeks to slowly test what your injury can do. More on this later. Simple adjustments that I find can be useful for everyday life is, first of all, to think about how are you using your hand. So the muscles that's affected are the ones that does this action. So often if you can do the same action but with your hand turned up, that uses a different muscle. And even if your hand is like this, these are the opposite muscles. So sometimes just thinking about the position your arm is in and switching that up can make a real big difference to how your elbow tolerates something. The other is to think about how much you're using that hand and can you use the other hand? Because I find that anything where you grip, push or pull with the injured arm can often irritate it. And even if it's a really light thing, if you have to carry it for long enough, that it's not just the weight, but it's the period of time you're gripping for can often irritate it. So if you can get into the habit of using the other hand for all of the things that you can use it for, that will really help. Another important thing for tennis elbow is avoiding repetitive movement, like knitting or something like that, where it's the same movement, small movement the whole time. That can really irritate a tennis elbow. So think about repetitive movements and try to limit those. But then also just simply think about what movements actually does hurt and can you leave them out for a bit. So if we think about sports specifically, there's often stuff that really irritates it versus things that you can do without irritating it. With tennis, typically it's the backhand that's the most aggravating because that uses that action again. And often people can still continue training and practicing the forearm, depending on how painful their elbow is at that point. So think about how you can make adjustments, play with the position your arm is in day to day, and use the other arm more or ask other people for help. Now, if you're working in an office and it's things like typing or using the mouse that's irritating your elbow, resting it completely is not an option because you actually have to work. But there are things you can do that can make a massive difference. And the first one, and the most important one, or the most useful one for my patients is usually, again, if we think of the position those muscles work in, if you change from using a standard mouse where your hand is in this position, can you see those muscles are going to work the whole time and it's going to have to do that action as well, which is repetitive movement. If you use an upright mouse that takes your hand into this position, you're immediately offloading those muscles and it can make a massive difference to how your pain feels. So I'll put links to upright mice, what do you call them, in the description of this video that you can see what I mean. But there are several different types that you can look at. The second thing is to play with the height of your keyboard. So this may mean that you either have a desk that's adjustable or you have a chair that can go higher, or you start standing and working that you can be higher. Because if my keyboard is quite high, can you see that my position of my arm, even if it's subtle, is going to force my wrist extensors to work more while I'm typing. But if I'm going to hunch my shoulders up to fit into the video, imagine I'm a little bit higher, if my keyboard is lower, can you see that now I'm not having to lift it up, it's there. So it doesn't have to work as hard. So changing the height of your keyboard can be a real game changer in that instance. But third, and I never actually realized this until a few years back, you can get different size keyboards. And obviously we are all different shapes as humans. And if your keyboard is really large compared to your shoulder girth, then you're going to have to do big movements and it's going to turn into more repetitive movements than if you have a keyboard that's a good size for you and you can reach everything without actually having to go very far out or very far in. So figuring out the best keyboard size for you is another good one. And then lastly, The research is quite clear on it, that it doesn't matter how good your desk setup is. If you're going to work for hours and hours on end and not take a break and not do some exercise or movement in your break, it's not going to help. You're still going to overwork things in your body. So it's really important to get into the habit of several times in the working day, getting up, doing some movements, just getting blood flow and then going back to it. I've made a video where I've discussed the best desk and chair setup for neck pain actually. But to be honest, all of that applies to tennis elbow as well. So have a look at that video. I'll put a link in the description of this one so you can see the different options for desks, for keyboards, as well as get some ideas for computer mouse, still don't know. So what about the gym? How can you do load management properly in the gym? The tricky bit with going to the gym is that any exercise that requires gripping, pushing, pulling will actually work the muscles involved with tennis elbow. And if you think of weight training, that's basically all of them. So the first thing you've got to figure out is what level of exercise or loading can my tennis elbow handle at the moment? Because it won't have the capacity to deal with all the exercises or the weights you normally do. I would suggest, first of all, cutting out all the exercises where you can't adjust the weights. So if we think of body weight pull-ups, for instance, you can't make it lighter necessarily, well, unless you have bands or things you can put around you, but it's difficult to make it that light that it can be useful. So I would cut that type of thing out first and go for exercises that you actually use free weights or machines to be able to really understand the weight and how much load you're putting through it properly at the beginning. Then also, it's sometimes not about how much you're doing of one exercise, but actually the volume of exercise that involves your gripping or your pushing or your pulling. That's the problem. So I would reduce the number of exercises for your upper body dramatically and just maybe pick one or two to test first. Obviously, make the weights super light. If you make all of these adjustments and your elbow just still doesn't feel happy, you're just going to have to rest it. And it's best to not deny that you've got to rest it for too long, because if you try to experiment and still train with it for weeks and weeks and weeks, you can actually make the injury worse. And then when you go back, do it much slower than what you think you should be doing. I always say to my patients, pick only one exercise, perhaps even, that uses your arms, maybe two, and use weights that actually makes you embarrassed to use them in the gym. That's when you know you're going light enough. It's much easier to do a very light session and then go, oh, I was absolutely fine after that, and make it harder slowly over time than it is to jump in, feels fine while you're doing it, but then 24 hours later, your arm's killing you, and now you've got to take several days off to allow it to calm down and then go back to it. That second method just leaves you demoralized. So I would always say, go in much lighter than what you think you should, and then just increase it slowly over time. You will actually find your recovery is going to be quicker. Let's move on to treatments that can be useful for short-term pain relief. These treatments are really good at reducing people's pain, but it only works in the short term. It doesn't bring about long-term healing. I can hear you thinking, why would I bother with them if it's not going to actually help my injury heal? Well, pain can make your life miserable. It can interfere with your sleep, interfere with your work, and actually stops you from enjoying social events. It can also stop you from doing the things you should be doing to help your injury recover, like your rehab exercises. So getting on top of your pain and calming it down as quickly as possible can be a really useful thing as part of your whole treatment plan that you have. The first thing you can do, that anybody can do, it doesn't matter where you're in the world and you don't need equipment, is to think about what position your elbow is in when you sleep and when you sit. If you can sleep with your elbow straight, that you don't bend it up, that can make a massive difference. I don't know why, there's something about keeping that elbow bent for extended periods of time that seems to be irritating the pain for my patients. I think it's a little bit like pressing on a bruise. The more you kind of put pressure on the injured area, the more the sensitivity increases and the more the pain increases. So I know it can be super difficult to train yourself to sleep in a different position than normal or to control what you do with your limbs. But for my patients who's figured it out, sleeping with their arms straight has been an absolute game changer. The other thing is sitting during the day. That's probably the easiest. just to be aware of what you're doing with your elbow. And if you don't have to have it in this position, have it straighter, just relax it next to you. Think about what position your elbow is in. Massage can also be a really useful tool to help relax the muscles and just decrease your pain. But if you apply too strong massage in the wrong stage of injury, you can make things worse as well. So if your tendon is in the reactive stage where it's really irritated and easy to flare up, you want to be doing only gentle massage, and you probably want to avoid going over the tendon itself, especially with really hard massage, because that usually just makes things worse. If you've got an ongoing case of tendinopathy, so a chronic case that's maybe entered the disrepair or the degenerative phase, you can usually do hard massage, but it will depend on how sensitive yours is. The gauge for whether you're doing the right level of massage for you is it should feel comfortably uncomfortable. If it feels really uncomfortable and you're kind of just praying for the person to stop, that can often lead to a flare-up in the hours afterwards or the next day. Yes, you can go quite firmly over the tendon at that point, but again, it's just got to be a comfortable, uncomfortable pressure. And you can use a massage gun for this as well. If you are going to use a massage gun, I would advise that you use a lower frequency, so about 2,400 percussions per minute or lower. You spend about 2 to 3 minutes over the whole area in this area, because there's not a lot of muscle there, and if you overtreat it, it will get worse as well. You aim for a comfortably uncomfortable pressure, so not as hard as you can, and you leave at least 48 hours between treatments to allow it to recover and react to the treatment. Otherwise, you may end up overtreating it and making the injury or the pain worse again. What about breaking down adhesions with massage? I often see on the internet that people discuss, oh, you've got to do it to break down the adhesions, it really works. First of all, there's no evidence in the research that that type of massage actually works for tennis elbow. Second, it tends to be really, really painful. So for every person that swears by it, I've also seen one who's flared up and their symptoms have been made massively worse by it. Also, if you think about the injury mechanism and what actually happens in the tendon, there's not really adhesions as part of this injury process. It's the tendon that loses strength and endurance and structure in there. So breaking down adhesions, although it sounds plausible, is likely not what's happening with that type of massage. By all means, if it works for you, carry on with it, because then it just means that strong massage is helping your pain. Is it really breaking down adhesions? I doubt it. But also know that if you've got a really sensitive tendon, it may actually make it worse, and you're better off applying massage that is comfortably uncomfortable rather than just digging in there and grinding your teeth and just tolerating it. There are 3 types of braces that you can use for tennis elbow, and 2 of them have been shown by the research to be quite useful. The first one is a wrist splint. It may sound a bit weird to have a wrist splint on to help your elbow pain. Remember that it's that action that uses the muscles that flares it up. So if you can rest it, that it doesn't do that action, it can actually help it calm down. And the research shows that yes, for a lot of people, that can make a big difference. The other one is an elbow strap. They think it works because it changes the pressure on the tendon, and it kind of changes where the tendon takes its load when you use it. For some people, that can be really, really useful, but for some people, it can make it worse. The good news is they're quite cheap to try out, so if it doesn't work for you, you can just discard it. And then thirdly, you've got elbow sleeves, which is just something that firmly fits around the whole elbow and keeps it nice and warm. These have not been researched, and I'm not sure how useful they are, although I do have patients who swear by them. It's something to try if nothing else is working for you, but it's not something I actively prescribe to my patients. I have made a whole video about how you can decide which brace is likely going to be useful for you, depending on your stage of recovery. Also, how often to wear it, when not to wear it, and when to really take it off immediately. So if you want to know the details of the braces and see examples of it, check out the description of this video. I'll put a link to that video in there, and I'll also put some links to some of the braces in this one that you can go check them out. Then we've got taping techniques, and so far there are 2 techniques that the research has shown might help some people's tennis elbow pain. The first is a zinc oxide method. The zinc oxide tape is non-stretchy tape. It's tape that you can easily tear, and it's quite supportive. This one forms a diamond around the painful area. The thinking is that it works because it's offloading the painful tissue. And the second method uses kinesiology tape, which is the lovely stretchy tape that stays on and is usually quite comfortable. People think that perhaps it's offloading the area. Other people think that no, it's just affecting the pain receptors, how they react to stimulus. The research isn't quite clear on that one yet. We've made a detailed video and article that takes you through a step-by-step process of how to do these taping techniques. So go have a look at those. Links are in the description of this video if you want to know how to do them. What about ice or heat? Which one works best? There's no evidence in the research that either ice or heat will speed up your healing, but it can help some people to reduce their pain. If your tennis elbow flared up only a few days ago, it's best to use ice only, because for some cases of tennis elbow in those early stages, there may be quite a bit of inflammation involved. And if you add heat to that, you could make it worse. But if you've had your pain for quite a few weeks, then you can use heat or you can use ice. It doesn't matter, because there's usually no inflammation that you can make worse. The thing to understand is that overcooling tissue or overheating tissue is equally bad, because our bodies like an equilibrium. So whenever you apply ice, you only want to apply it for maximum 10 minutes at a time. Remove it for 10 minutes and reapply it for 10 minutes, and you only use it if you really need it for pain. Same thing for heat. If you're applying heat, it should be a comfortable heat. It shouldn't be so hot that you actually end up burning yourself or feeling really, really uncomfortable with it. So choose something that is like a warm hug and just allows it to relax a bit. Heat, you can usually keep on for a little bit longer than ice. That's usually okay, as long as it's not too hot. Another question that I'm often asked on the internet is, oh, I've got this injury. What medication can I take to help it heal? With tennis elbow, there isn't a medication that's going to help it heal. That's just not how this injury process works. But anti-inflammatories may be useful in the reactive stage to help calm your pain down. The only thing I will say about that is only use them if you really, really need them, because they don't help healing necessarily. And there is some evidence that perhaps it can maybe not be good for healing either if you use it too much in your treatment. So only use it if you really need it, if the pain is keeping you awake or it's really driving you insane during the day. And you really only want to use it for the acute stage, so that reactive stage of tendinopathy. Because when you've got ongoing or chronic tendinopathy, there's usually no inflammation involved. And there's evidence to show that if you use anti-inflammatory medication while you're trying to do strength training, you don't actually get such good gains from your strength training. So don't just take anti-inflammatory medication because you feel pain and even though it's not that bad. Only use it if you really need it, because then it can be useful. If you have quite strong and severe pain and your case is an ongoing case or chronic case, your doctor may actually place you on other types of medication. Usually something that's often prescribed for epilepsy or other conditions like that, because that works on the more central nervous system to calm the pain system down. So speak with your doctor if you're in pain and you've had this injury for a long time. They can usually decide on the best medication that may bring your pain down for you. I'm going to look at dry needling and acupuncture together because they both use the same type of really thin needle. The main difference, if I can simplify this terribly, is that with dry needling, you place the needle directly into the painful areas of the muscle, usually targeting what we used to call trigger points. And with acupuncture, you go on energy lines. Interestingly enough, research has shown that a lot of the trigger points actually exist in these energy lines. There's an argument about how similar these things really are. Now, for dry needling, there are 2 recent reviews that show that yes, it can be beneficial for tennis elbow. And one showed that specifically if you target the trigger points or the most painful points in the muscles, that seems to work better. In that review, they suggested that the best treatment frequency was 2 to 3 times per week. In my experience, you don't need dry needling that often. I've found that it can make a big difference to my patient's pain, even if they have it once a week. For acupuncture, there's also evidence in the research that it works better than placebo treatments. Only thing about these research studies I would note is that what the researchers who compiled the meta-analysis and the reviews found was that the studies they included were actually of very low quality. They were very small studies and there was a high risk of bias, which means that if we have better quality studies or larger studies in the future, we may find that actually acupuncture and dry needling works better than what we thought that it does, but we may also find that actually it doesn't really work and it's a waste of time. So I would just keep in mind that the research is not 100% saying, yes, go for it, it will definitely work. But if your tennis elbow is carrying on and you just want to see if it can help reduce some pain, it's definitely something I would try. Now, despite therapists often using electrotherapy to treat tennis elbow, there's actually very little research to back it up, and the research that we do have is of quite low quality. There are 4 electrotherapy modalities that has some research behind it. The first is high-intensity laser, and that has been shown to help with pain. Then you get low-level laser therapy, and it's been shown to be useful for treating tennis elbow, but the research on that is of quite low quality. TENS doesn't seem to be useful at this point for tennis elbow. The research doesn't back it up. And then we've got ultrasound. And again, the research on ultrasound is quite conflicting. So there's no clear, yes, it works or no, it doesn't work. And the studies that has looked at it has also been of quite low quality. So for electrotherapy, it's a nice to have, I would say at this point, but I wouldn't pay for just having electrotherapy. You need to be getting something else out of that treatment session as well. The final treatment we're going to talk about when we think about short-term pain relief is joint mobilization. There's evidence that mobilizing the elbow joint, the shoulder joint, even the neck or thoracic spine can be useful for reducing pain in tennis elbow. And mobilization is when you do gentle repetitive movements to just get the joints moving. Why would moving the neck and this area be useful for your elbow? Well, sometimes injuries here can actually contribute to the pain you feel over here versus the other way around as well. Manipulations and mobilizations are not the same thing. So mobilizations are the gentle movements. Manipulations are quick thrust movements where you typically get a crack or something when you do that movement. I'm not a fan of joint manipulation, which is the quick one, because it can cause serious injuries, where joint mobilization doesn't tend to cause serious injuries. And for myself, I just feel that the risk outweighs the benefits. I mean, if you're just going to get short-term pain relief, why would you risk a technique that can actually cause you a serious injury? We've already spoken about the best treatment for long-term pain relief, which is load management. The second best treatment is rehab exercises. There are several different types of exercise you can use to help treat tennis elbow. And which ones work for you will depend on the stage of injury you're in, also the sensitivity of your tendon, and then also what other types of areas are affected and contributing to your tennis elbow. The biggest mistake people make when it comes to exercise is that they jump in too quickly and actually do the exercises too strongly. If you have a super sensitive reactive tendon at this point, the worst thing you can do is add strength training exercises, because that tendon actually in the reactive phase just has to rest and recover. It doesn't need to build strength, because in the reactive stage, if you watch the other video, it hasn't lost any strength. It is just super sensitive. If you add strength training exercise, then it just makes it worse. So let's have a look at what exercises are useful in different phases or stages of injury. There are actually 3 types of exercise that can be used for any stage of tennis elbow recovery. I've made a detailed video and article about this where I go into the details of what exercises to use and how to do them properly. So have a look at the description of this video if you want a link to that. But here's a quick overview. So the first is stretches for the wrist extensor muscles. Now, remember, the wrist extensors work there. So if you want to stretch it, it's the downward movement. And depending on how sensitive your tendon is, you can do simple stretches that doesn't place a lot of strain there by simply keeping the elbow bent while you do it. And if it's not that sensitive, you can increase the stretch by just adjusting the position you stretch it in. And like I said, I demo it in the other video in detail. Then we get mobility exercises for the neck as well as the shoulder. Why can that be useful? Sometimes a very stiff neck or shoulder or injury to one of those areas can actually be contributing to your tennis elbow pain. It is possible that most of the pain is actually coming from up here, but it feels only like a tennis elbow. So if your therapist has assessed you to need something for those areas, they may include exercises for that. And the nice thing is you can start with those exercises even in the early stages of recovery because it doesn't load the area specifically. The third type of exercise that could be useful is neural mobilization exercises. What does that mean? Well, basically our nerves run from our spinal cord into the tips of our fingers, and there are several big nerves in your arm. And there's one nerve that runs really close to the area where you get the pain with tennis elbow. If you've had ongoing tennis elbow, that nerve can get a little bit stuck and not move as smoothly as it should and contribute to the pain. But also, if something else is irritating that nerve and stopping it from sliding properly, it can actually cause pain at the elbow. So adding in movements that just helps that nerve to slide again can be really, really useful. This doesn't mean just jump in with it and do it, because if that nerve is still stuck and you're trying to make it slide, you can make your pain feel worse. So watch the other video or read the article so that you can understand how to sensibly add that into your rehab program. Exercises that should only be used in the disrepair and the degenerative stage are strength training exercises. Why only in those stages? Well, first of all, if it's a reactive tendinopathy, your tendon's just been painful for a few days, it hasn't lost strength. It doesn't really need to rebuild strength. It needs to just calm down and then ease back into things. But if you've entered the disrepair or the degenerative phase, you've got changes to the structure of the tendon and it's lost a bit of strength. So you need to help rebuild the strength and the capacity of the tendon. And these exercises can be chosen depending on what irritates it. Sometimes it's best to start with exercises that actually don't work the wrist extensors specifically, but rather just get them to isometrically contract. So there's lots of ways to adjust that. And I've discussed it in detail in the article and the other video. So have a look at those. And then lastly, if you are a sports person, it's worth getting somebody to look at things like your technique. Because for instance, we use a whole kinetic chain when we play tennis. And if you're not using your hips and everything to produce part of the force or as much as they should, you're going to overwork this area and strain this area to create more force. So it's really worth having somebody look at you and see, can you improve your technique to help your elbow pain? It may also be that actually you have a lack of mobility in other areas or just a lack of strength in other areas. So for sports people, it's really important to get a picture of the whole body and understand, is there anything else we need to be looking at? How long can you expect your recovery to take? Well, the research shows that most cases of tennis elbow will recover within 3 to 12 months with conservative treatments, the things I've just mentioned in this video. But these treatments don't work for everybody. If you've been trying proper load management and the correct treatments for 12 weeks at least and not seen any improvement, so we're not looking for complete recovery at 12 weeks necessarily, but you want to be seeing that what you're doing is helping the pain calm down and you're slowly improving. If you're not seeing signs of that, it can be useful to add other things. One of the things you could try is shockwave treatment. The research shows that shockwave is more effective than injections, but it doesn't work for everybody. And it's important not to actually use it in the reactive stage of tendinopathy when your tendon is still super irritated and it's only been present for a couple of days or maybe a week or so, because that can actually make your pain worse and irritate the tendon further. If you've got an ongoing case that's been present for a couple of months or longer, then shockwave therapy can be quite useful. There are quite a few different types of injection that can be used for tennis elbow. So let's look at each of them with their pros and cons. First up, we've got corticosteroid injections. Corticosteroids, or for short, they call it cortisone sometimes as well, is thought to work by reducing inflammation. Now, we've seen with tennis elbow and the injury process, there's not a lot of inflammation involved, and also the inflammation that is there is actually thought to be part of the healing process. These days, doctors and researchers seem to agree that using corticosteroid injections for tennis elbow is not really a good idea. They seem to work really well to reduce your pain in the short term, but then they may lead to poorer long-term outcomes. I will say, however, there are some cases that just does not respond to anything else. And in those cases, corticosteroids can be considered. So it's not a total never ever, but it's kind of a last resort thing. One of the best known injections for tennis elbow are PRP injections or autologous blood injections. Now, all this means is they use your own blood to inject into the injured area. With PRP, they spin the blood really quickly to separate out the platelets from the rest of the blood and then inject those into the area. The idea behind that is that it creates a bit of an inflammatory reaction and it stimulates the healing process so the tendon can actually start healing. As for the research, there's contradictory results. Some studies are showing, yes, it does work, and then others can't really find a benefit of PRP above placebo injections. And to be honest, this is what I see with my patients in practice as well. Some people react really well to PRP, and then others don't really see any difference. But importantly, there doesn't seem to be any long-term negative effects. So I would say if you feel stuck with your tennis elbow and the pain just doesn't want to change and you've really been trying all the other things properly, the offloading and things, and it's just not making a difference, PRP is something that I would suggest you try. When PRP does make a difference, it's not a quick acting thing. In fact, you may get a little bit of a pain flare-up the day or the week after you've had the injection. It is usually a slow progress of calming down and improving then over a 6-week period. And usually by about 6 weeks, you start to really see a difference in your tennis elbow. Botox is another interesting one that they inject for tennis elbow. Botulinum toxin is the full name for it. And it's the same stuff that gets injected into faces to take away wrinkles. It works by temporarily paralyzing muscles. Botox is thought to work in 2 ways for tennis elbow. The first is that because it's temporarily paralyzing the wrist extensor muscles, it actually allows the tendons to rest properly because you can't use the muscles, and that allows it to recover. The second is that there's some evidence that Botox makes the body release some substances that can help calm the nerve endings down in that area and reduce your pain that way. Research shows that yes, Botox can be effective to help reduce the pain from tennis elbow for up to 6 months, but it doesn't affect the strength. So you do have to then carefully load it afterwards or when your pain subsides so that you can gradually regain your function and strength. Next up, we've got hypertonic dextrose injections. Now, the more common name for this is prolotherapy. And what they do is they inject a really high sugary fluid into the injured area. And it is thought to work by irritating the area and causing an inflammatory response that then kickstarts the healing process. But there's also evidence that perhaps actually it's affecting the nerve endings directly in that area and reducing your pain that way. So the research shows that yes, prolotherapy can be effective for reducing pain, but it doesn't seem to affect strength. So it doesn't help to strengthen the tendon. So you do have to combine it with a rehab plan after you've calmed your pain down. Stem cell injections is an exciting one that's been used more and more recently. The idea behind stem cells is that they can actually turn into any type of cell in the body. So if you inject them into an injured area, they are meant to then produce new cells in that area of the type of tissue you want and actually improve healing. We don't have a lot of research to back the results up yet. The studies that's out there are really small and not very high quality. So we don't actually know if stem cell therapy works at this point. It doesn't seem to be having any negative effects, but we also don't know if it's actually worth the money. Lastly, we've got hyaluronic acid injections. Hyaluronic acid is one of the main components of synovial fluid that you find in your joints, and they help lubricate the joints and help with shock absorption. It's not really clear how people think that it's meant to help with tennis elbow. As for the research, there's not a lot of research out there, and the little bit of research that is there has contradictory results. So again, we don't really know if it's that useful. If any of these injections works really well for you and calms your pain down, just think about how you go back to activities. The worst thing you can do is just jump back into full everything that you do in the day. Remember that anything you use your arm for will put load on it. And it is important to start reloading it, but just don't add too much into it. Think about deciding different things and small things and just gradually building the load and gradually building rehab if that's part of the treatment that you need. It's reported in the research that around 5% of people with tennis elbow will go on to have surgery. There are 3 types of surgery commonly used for tennis elbow these days. So the first is open surgery, where they actually open it up and do the surgery that way. Not that commonly used actually these days. People prefer to use either arthroscopies or even things like tennis. With arthroscopy, you make a little hole and you go in and you do the surgery that way. But with tennis and other things like TenJet, it's a very minimal invasive procedure. And for tennis, it's ultrasound waves they use to actually take the injured tissue away. And the nice thing with tennis is that you literally just go in for the procedure and you walk out and it heals really quickly. So that's why those type of procedures are actually favored above open surgery, because your healing time is so much more quicker and you don't get so much scar tissue that can then cause adhesions and problems in that area. Brilliant. Hope you found that useful. Now, please remember to hit like and subscribe to the channel. And if you want more help recovering from your injury, you're welcome to book a consultation with one of the team. The link to our website is in the description of this video. Take care.